Are you avoiding sugar, but your blood sugar is still high? The answer may be high glycemic index foods, not sweets. Let's talk about which ones to avoid. High blood sugar doesn't always come from sugar. Some foods raise glucose quietly, Marshall, meal after meal. As we get older, our bodies respond very differently to certain foods, and that's especially true for blood sugar. Today, I want to show you which high glycemic index foods may be working against your diabetes control. Hello everyone, and thank you for watching. My name is Dr. Ken. As an endocrinologist specializing in diabetes and metabolic health, I am committed to helping you achieve better health outcomes. If you are living with type 2 diabetes, and especially if you are over the age of 50 toms, this video is made for you. Today, we're going to talk about high glycemic index foods that many people with diabetes should limit or avoid. Let's talk about some truly common foods in America, things people eat often. For example, the classic cheeseburger, a staple. They're not always desserts, and many people are surprised to learn how strongly they affect blood sugar. My goal today is to explain this clearly, calmly, and in a practical way, so you can make safer choices without feeling overwhelmed. Let's begin with a simple reminder. The glycemic index, or GI, measures how fast a food raises your blood sugar. High GI foods raise blood sugar quickly. Low GI foods raise blood sugar slowly. For someone without diabetes, the body can usually handle these changes. But for someone with type 2 diabetes, fast blood sugar spikes place stress on the pancreas, insulin production, blood vessels, and the heart. Over time, repeated spikes contribute to higher A1C, worsening insulin resistance, fatigue, and long-term complications. That's why which foods spike blood sugar quickly really matters. Now let's talk about the foods themselves. One of the most common high GI foods in America is white bread. White bread is made from refined flour. Most of the fiber has been removed. Without fiber, the body digests it very quickly. This means glucose enters the bloodstream fast, causing blood sugar to rise sharply. This rapid increase releases insulin. The same applies to white rolls, bagels, English muffins, hamburger buns, hot dog buns. Even if the portion is small, the speed of digestion can cause a spike. Many patients tell me, "You think one slice won't hurt, but for blood sugar, one slice is plenty." Breakfast cereal is another major problem. Many cereals are marketed as low-fat, heart-healthy, whole grain. But in reality, many have a high glycemic index. Examples include cornflakes, rice cereal, puff-style cereals, instant oatmeal packets. These foods are highly processed, finely ground, and easy to digest. As a result, they often raise blood sugar very quickly, especially in the morning when insulin sensitivity is lower. For older adults with diabetes, this can lead to high morning glucose, energy crashes before lunch, increased hunger. White rice is a staple food for many people. But from a blood sugar perspective, white rice is a high GI food. It breaks down rapidly into glucose. The same applies to instant rice, rice mixes, rice cakes. Rice cakes are especially misleading. They are low in calories, fat-free, often labeled as light. They are not a good dietary choice for most people. But they raise blood sugar very fast. For people with type 2 diabetes, rice cakes can behave almost like sugar. You might be surprised to learn that potatoes are incredibly healthy. They're packed with nutrients. You especially want to avoid mashed potatoes, instant potatoes, baked potatoes without the skin, and French fries. When potatoes are cooked and mashed, the starch becomes easy to digest. They can be a very nutritious addition to your diet. This leads to rapid glucose absorption, high post-meal blood sugar. Even without added sugar, potatoes can have a very high glycemic index. Portion size matters too, but again, speed matters more. Sugary drinks are among the highest GI items in the American diet. It's crucial we understand the impact. These include soda, sweet tea, lemonade, and sports drinks. But also, and you're right, you're not fruit juice, orange juice, apple juice. Even 100% fruit juice lacks fiber. Without fiber, sugar enters the bloodstream almost immediately. For blood sugar control, drinking sugar is far worse than eating it. Common baked goods are another source of hidden high GI foods. You need to avoid foods high in trans fat. Things like cookies, muffins, donuts, crackers, and pretzels should be limited. These foods combine refined flour, added sugars, low fiber. They digest quickly and often lead to sharp glucose spikes, followed by energy crashes. Eating the wrong foods between meals can keep your blood sugar elevated throughout the day, leading to health issues. This is where many people get confused. Low-fat or diet-labeled foods often remove fat, add sugar, or refined starch. Fat slows digestion. When fat is removed, glucose absorption becomes faster. Examples include low-fat flavored yogurt, fat-free desserts, snack bars. These foods may be low in calories, but high in glycemic index. It's important to understand the impact on your body. For diabetes, this is really not a good trade-off. We need to find a better way to manage this together. As we get older, muscle mass decreases, insulin sensitivity declines, and recovery from spikes becomes slower. This means high GI foods have a stronger effect on blood sugar after age 50 or 60. What once caused a mild rise may now cause a large spike. That's why food choices that worked in your 30s often stop working later in life. I understand completely, and I want to assure you, you're in good hands here. You do not need to eliminate every high IGI food forever, but you do need awareness. Understanding which foods spike blood sugar allows you to choose better alternatives, control portions more wisely. Spikes can be a concern, but our focus isn't restriction. It's about stability, finding that calm, steady balance for you. If you take one message from today's video, let it be this. Take care of yourself, stay informed, and never stop seeking the truth about your health. High GI foods raise blood sugar quickly, even if they don't taste sweet. Things like white bread and rice have a big impact. Repeated spikes drive diabetes progression. Awareness gives you control. Small changes, made consistently, protect your health over time. If this video helped you understand how certain foods affect your blood sugar, please consider liking the video. And if there's a food you're unsure about, feel free to leave a comment below. Welcome to subscribe for more doctor-guided education on diabetes, nutrition, and healthy aging. I'm Dr. Ken, Diabetes Care, and thank you for watching.